So everyone ready? Namaskar.
Namaskar.
Come on, let's settle down. एक minute extra ले लिया, and we appreciate your patience. So let's connect with each other by going up, and then two, wishing each other, giving thanks to the nature surrounding for purity around us. So we are the blessed one. After turn, twist, and stretch with closed eyes, just sit for a minute. हम मैजिक एक मिनट का भी समझते हैं हर दिन अपने आप पे फोकस करते हुए आई एम वेरी श्योर यू आर यूजिंग दिस टेक्निक एवरी डे suddenly that calmness starts spreading in body also the mind तभी तो हम सांस को देख रहे हैं otherwise we are so busy and involved in other activities than this yoga with your own self. Within these few seconds, whole world within is changing. With that faith, let's join hands in Namaskar Mudra for prayer. Om Sahanavavatu Sahano Bhunaktu Sahaviryam Karma Vahai तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शांति 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 with breath pulling stretching
Today, this particular prayer, Sahana Bhavatu, Sahana Bhunaktu, whatever we can do together, has got a very different and very special meaning and purpose. That today we'll be joined by Dr. Major Anurag, who's the MS in orthopedics, and he's the one who would be joining. And this Sahana Bhavatu, that the journey together is going to continue. He'll be talking to us on osteoporosis. We are live on YouTube. We are also live on Facebook. And of course, all those who got Zoom link, they are together.
so you can spread the word also पहले भी किया ही है अभी भी किसी को इन्फॉर्म करना है तो कर दीजिएगा and let's begin our cleaning process breathing के साथ शुरू करते हैं दोनों पैर आगे straight किए हुए pull your hands up fingers together backbone straight legs tight let the back side of your legs press with the ground toes pull towards you and give the exercise to backbone from inside also by doing Kapalabhati for cycle all 120 times together.
Your arms are along the ears. You are pushing yourself up. Hips are on the ground. Feet pulled towards you. Back of the knees touching the ground.
This is engagement within self and with self, and that way you are loving your own self. Understand body posture, controlling breathe out, involving mind, those thoughts within, observing the changes in the body, effect on internal organs and all different processes.
Very good, Sunil sir, Akash sir, Kamita ma'am, Sandeep Dhawan sir, Ritika ma'am. Excellent, Anita ji. That is the rhythm.
We know in Kapalabhati, stagnant energy. We are pushing out forcefully. Exhale longer. यहाँ पे लॉन्ग तो नहीं है, डीप है, फास्ट है, फोर्स के साथ है। जो हमारे लंग्स में नहीं चाहिए ऐसे टॉक्सिन्स बने रहते हैं, उनको निकालने का तरीका।
गुड क्वेश्चन सुधीर सर, सुचिता मैम, ज्योति जी।
In a way, doing warming up of our internal processes, internal organs, थोड़ा सा ब्लड फ्लो बढ़ा रहे,
गुड डॉक्टर मंगला गौरी मैम, श्रीकांत
थोड़ा
सर।
सा क्लीनिंग के लिए ही रेज कर रहे। आपने देखा होगा कि इवन स्वेटिंग शुरू हो जाता है कपालभाति में। आप तो एक जगह बैठे बैठे कर रहे। सो लेट्स लव अवर बेबी। एक ट्विन में से पकड़िएगा नियर द हार्ट, pull the leg towards you and it is walking on all lower body, torso, including bones, joints and muscles. Shruti ma'am, you can hold the knee on the elbow instead of holding like this. Hold your baby near the heart. बेबी है तो प्यार है, बेबी है तो स्माइल है, हैप्पीनेस है, होल स्वेगिंग। With that smile, let's give love and kiss your baby in the center, then the toe, and then let us hold another twin near the heart. जितना पास में ले सकते हैं पैर को पूरा लीजिए। इट इज वॉकिंग ऑन सर्टिका लैम्बर with the arms, shoulders,
वेरी गुड क्वेश्चन
cervical.
राखी जी, श्वेता मैम,
Very
सरिता जी।
nice, Srikanth sir. इतना सिंपल, इतना सरल, but it's working on all different joints in our body, from foot till cervical.
वेरी गुड वीणा माहेश्वरी मैम।
Not forgetting even our skull, although joints are also getting stretched.
Can the baby be little closer to you, Anu ma'am? It's okay. Santosh ji, doing it good.
Love your baby. Second one. पार्शियलिटी तो हमारी कुछ भी नहीं, दोनों को एक साथ समानता देते हैं हम।
Excellent, Manisha ma'am, Veena Bhan ma'am.
And I'm sitting in Baddha Konasana, one of the best for lower body. Hip joint, hip ball, hip sockets. So in this lower body fully stretched, expanded, upper body, wrap your hands and compression on lungs, on chest, upper lobes of the lungs and trachea. Second one, Dhokan Kriya, exhale through mouth.
Excellent, Tarun sir. Try to push palm to palm. Very nice,
One
Poonam
of
ji,
the best
Kashipur.
for removing extra heat from abdominal region, and that's why Dhokan Kriya works on our Manipura chakra, improves our digestion. Beautiful stretch on shoulders, on shoulder blade, even our backbone.
Very nice, Swati ji. वर्षा मैम, सुभाषा, बहुत अच्छे। पूनम जी, मम्मी के साथ। गुड गोइंग डॉक्टर शुभांगी जी, गुरुला मैम। Try to push knees to the ground.
In between changing hands, क्योंकि इक्वालिटी हाथों में भी तो लाना है। जैसे दोनों पैरों को हमने यूज किया, वैसे ही हमारे अपर बॉडी पे भी वही इफेक्ट देना चाहते हैं। दोनों साइड से भी हमारे हाथ स्ट्रेच हो जाए। We'll understand when we perform this asana, then we understand that it is different. Different sets of muscles are used.
In Dokan Kriya, we are removing impurity from the mind also, from the body, from the lungs, बहुत बढ़िया प्रवीण सर, रंजू मैम के साथ एक्सीलेंट।
As usual, end with deep, thorough inhale, maximum air inhale. Let that oxygen get absorbed in Antakumbha. And release the breath longer and deeper. जो नए मेंबर्स भी ज्वाइन कर रहे हैं वो भी कर सकते हैं ये ब्रीदिंग एक्सरसाइजेस। इसमें तो बस क्लीनिंग ही है ना, तो इसके कोई साइड इफेक्ट्स नहीं होंगे। अपने स्ट्रेंथ से जरूर करना है ताकि कुछ और गलत इफेक्ट नहीं आएंगे। सो put the hands near your hips, fingers turning in, feet together, knees together, go on the side. काटी चक्रासन। हमने बद्ध कोणासन में स्ट्रेच दिया तो अभी ये मसाज है। एब्डोमेन पे भी है तो लोअर बैक का भी ये कंफर्टेबल मूवमेंट है, स्ट्रेच है। Here, breathe in and breathe out. Perfect coordination. As usual, what we are doing, along with moments, maintaining pleasant smile on the face. है ना संजय सर, भाग्यश्री मैम, not less than 12 to 15 times both sides. कटी चक्रासन, स्टमक मसाज, दोनों पैर टाइटली पेट पे प्रेस है। We are using hands, अदरवाइज बैक तो पीछे राउंड हो जाएगी, वो नहीं होने के लिए हम हाथों का भी यूज फॉर्मली कर रहे हैं।
Extremely good, Dr. Jagdish sir, Rupa ma'am. Keep the knees together, Jagdish sir. Good, Dr. Sanjay sir.
चलिए चलते हैं थर्ड साइकिल पे। 3 साइकिल वार्मिंग अप के लिए, स्ट्रेच के लिए, स्टिमुलेशन के लिए। प्रणव मुद्रा। First 2 fingers pressed with thumb, other 2 straight tight. Left hand on the knee. एक हल्का सा प्रेशर लेफ्ट साइड पे दे रहे। राइट हैंड यूजिंग फॉर वाट क्रम कपालभाति, लेफ्ट टू राइट, राइट टू लेफ्ट, मीडियम पेस विद स्पीड।
Veena ma'am, आपका palm should face up. Yes. Very good, Kiran Singh ma'am. Good to see Miss Srita Puri ji, Vinod Kumar ji. Keep your camera on, it's good. Anjali ma'am. It's a rhythmic breathing. Breathing in and breathing out, alternate nostril, Vatakam Kapalbhati. It has got power to remove angina from anywhere in the body.
एक वो विचार भी ट्रेवल करने दीजिएगा। दिस प्रोसेस रिमूविंग नॉट नीडेड गैसेस, सॉल्ट्स, ह्यूमिडिटी थ्रू दिस फोर्सफुल एक्सेल, जो दिन में हम कभी नहीं करते। इसलिए ये योग में है, प्राणायाम है। ये टेक्निक सिंपैथेटिक पैरासिम्पैथेटिक नर्वस सिस्टम पे बहुत ही इफेक्टिवली काम करते हैं। नहीं चाहिए ऐसे टॉक्सिन्स निकालने के।
दीपा मैम, आज आपका कैमरा बंद है।
फोर्स है, स्पीड है, कंटिन्यूटी है।
गुड, अंजू मैम।
So listen to that music of your own breath.
Very nice to see everybody changing his own legs on your own. Yeah, once you complete your cycle, then we are ready to welcome our guest today. We have Major Dr. Anurag.
Let us welcome him.
That chair was vacant for him. And I will request Sujata ji to just welcome him very simple way. We have this special session on osteoporosis, wherein our expert Dr. Anurag would be talking to us. And of course, we have got a lot of questions from you all. Some of the questions we could pass on to him. But before that, let me tell you, he is one of those doctors who advises people, why do you want to do surgery? There are simple methods available. He is one of those who will tell you, ये बहुत expensive है, इसको करने की जरूरत नहीं है. You do a very simple technique and that will help you to get over your issue. So that is what Dr. Anurag with us. He is the consultant orthopedics, got his own clinic in Dhattoli, Nagpur, the Asia's biggest concentration of medical hub, and he's a resident doctor with Viveka Hospital in Nagpur, one of the very multi-speciality hospital. So, Dr. Saab, welcome to you.
बहुत ही कॉमनली सवाल उठते हैं कि बोन्स की केयर कैसे की जाए. हम तो तभी देखते हैं डॉक्टर साहब जब हमारे बोन्स दर्द देते हैं या जॉइंट पेन शुरू होते हैं, तो वो केयर कैसे करी जाए, कब से करी जाए?
गुड मॉर्निंग टू एवरीवन. बहुत ही अच्छा लगता है सुबह जब योग से स्टार्ट होता है. इट इज जस्ट प्योरेस्ट थिंग टू स्टार्ट अ डे. ऑस्टियोपोरोसिस एक साइलेंट किलर है and very few of us will take care of osteoporosis. Osteoporosis is it is not a disease as such कि bone में कोई disease हुआ है. It's a quantitative issue. It's not qualitative issue कि bone की quality खराब हुई है. Bone में जब mass उसका कम होने लगता है, mineralization कम होता है, जनरली हम osteoporosis को relate करते हैं कि कैल्शियम कम हो गया. Calcium is just one part of that bone. There are cellular, non-cellular and extracellular things. Cellular means जो cells उसमें काम करते हैं जो कैल्शियम डिपोजिशन में मदद करते हैं. एंड नॉन सेल्यूलर में आते हैं प्रोटीन्स जो उसके अंदर एक आर्किटेक्चर बनाते हैं. Bone is just not a calcium. It is a complex thing which include like a microstructure which is made up of collagen and protein. जो बहुत कॉमनली मिस होता है वो प्रोटीन होता है. हमने सालों से कैल्शियम खाया है बट फिर भी बोन वीक है, बोन टूट रही है, पेन हो रहा है. सर मैं 40 साल से कैल्शियम खा रही हूँ बट स्टिल आई एम हैविंग पेन. 30 years आई एम हैविंग पेन. बट हमने मेन एक इंग्रेडिएंट उसमें का मिस किया है, वो है प्रोटीन. कैल्शियम लेते हैं बट D3 नहीं लेते हैं. D3 इज रिक्वायर्ड टू एब्जॉर्ब कैल्शियम फ्रॉम योर इंटेस्टाइन, और वो कैल्शियम जाके डिपॉजिट होगा. उसके लिए डिपॉजिशन की एक जगह बनाती है, वो है कोलेजन. तो कोलेजन एंड प्रोटीन इज रिक्वायर्ड. बहुत कॉमनली मिस होता है. मोस्ट ऑफ अस आर वेजिटेरियन इन इंडियन फूड डाइट, सो कोलेजन इज मिसिंग देयर. तो प्रोटीन इंटेक इज नीडेड मच. एज एज ग्रो हमारा इंटेस्टाइन एब्जॉर्प्शन भी वेरी करता है. प्रोटीन आप खा रहे हैं बट एब्जॉर्ब नहीं हो रहा है, सो यू नीड सप्लीमेंट फॉर दैट. somebody takes कि मैं प्रोटीन शेक ले लिया, खाना बंद कर दिया. You take protein shake and you don't eat. It is supplement. It is not replacement. जो people miss करते हैं कि you take that protein shake and don't eat. So that is a major miss. So you take that thing, you take supplement of proteins also. So ये दोनों अगर any female taking proteins, calcium and D3 for a period of a year or so, you will have very less knee pains, very less bony issues, very less spine issues. And females are common in osteoporosis by because they undergo menstruation, they have that childbearing, then they have breastfeeding, and they undergo menopause early compared to men. So estrogen उनके इसमें सबसे ज्यादा जरूरी होता है हार्मोन रिप्लेसमेंट एंड कैल्शियम डिपोजिशन के लिए. ऑस्टियोपोरोसिस एक बहुत बड़ा टॉपिक है और बहुत कॉमन टॉपिक है. एवरीबडी इज अफेक्टेड. सोशियो इकोनॉमिक स्टेटस, it is not related to socio-economic status ki we are having good meal and everything and we are not affected. It is everybody's topic and everybody is affected with that.
One of the participants, he's called when asking a question from Delhi, and it is common in many places. That is it hereditary? Is it does it get affected because of chikungunya, having numbness in fingers, and because of any of such diseases? And how do you take care of your body and the mind to prevent this? I put all 3-4 questions together.
एक सेकंड. आर वी ऑडिबल? आवाज सही आ रही है क्या? गुड, वेरी गुड. ओके.
हेरिडिटरी नहीं है क्योंकि ये हेरिडिटरी है जिनके जेनेटिक डिसीज है. बट देन ऑस्टियोपोरोसिस का डेफिनेशन ही अलग है. डेफिनेशन मीन्स बोन क्वालिटी इज नॉर्मल but destruction is more as compared to the healing and production. So anybody, any man, either male or female, they achieve their peak bone mass at 25 to 30 age group. And that 25 to 30 age, generally we have a, nowadays we have a sedentary lifestyle. जॉब मिल गया है, काम करना है, खाना फास्ट फूड के तरफ ज्यादा जाना है, एक्सरसाइजेस कम करनी है, क्योंकि यू आर नॉट गेनिंग वेट इन दैट एज ग्रुप. Whatever you eat, you absorb. So if you are not gaining that peak bone mass in 25 to 30, the chances of getting osteoporosis is very severe. सो अभी जो हो रहा है मैक्सिमम अभी कि आउटडोर एक्टिविटी बंद है, नो प्ले ग्राउंड, नो बडी गोज टू स्पोर्ट्स इन 25 to 30, and then they once they achieve their career goals and everything, then they start at 38-40, they start activity की स्क्वॉश खेलने लगा हूँ, स्विमिंग जाने लगा हूँ, साइकिलिंग करने लगा हूँ, बट नाउ नी पेन इज देयर, bony pain is there. Why it is there? My colleague is not having that bone pain because he had trained his body, he had achieved his peak bone mass between the age group of 20 to 30, and now he is experiencing all the things. So
one thing is very clear that it is not hereditary.
It is not hereditary.
And the second part is, of course, whatever we have done at the age of 25-30, that will matter
most because you are achieving. If you are having enough balance in your bank, then you can spend. If you don't have your balance in your account, then you cannot spend much. Then
और किडनी पेन या चिकनगुनिया वाले हुए जॉइंट पेन,
joint pain,
they be cured?
this is a just shifting of viral infection. Just since 2004, you start. We have this viral infection going towards virus survives in your body. He tried to survive. You give whatever medicines, your immunity fights with him. So he tried to go to the place where you don't have much blood supply or much of the immunity going there. So it is a cartilage. Cartilage is a place where you have very less blood supply. So most of these viruses nowadays are going towards cartilage, and body try to remove that virus or part of that bacteria or anything. So then the immunity doesn't differentiate between a virus and cartilage. So bone destruction, cartilage destruction is more with the viral also. So post viral, if you don't take proper diet, proper supplements, then the chances of having this bony pain is much more. So if you take proper diet during that viral period and post-op also you maintain that thing, vitamin C and all the supporting ingredient, then you don't have much of the issues. Some guys you see in chikungunya or in COVID also, if they're taking proper diet, they don't have bony pain. If somebody started with that bone pain, cartilage is gone, that is gone for life. That is never coming back. Cartilage once is gone, regeneration is very slow because after 30 or after 40, you don't have much of the regeneration process. Some of us will have some issues, some will recover, but these are the number is some, not maximum. So some
Not
will
all.
recover, not all.
And then we have faith if we follow yogasana every day.
Yoga, yoga,
Actually, when we connect, we have already gone by that age of 25-30. I'm sure. I mean, some of you are definitely at the age of 25-30. दिल से वहीं पे है आप. आप दिल से वहीं पे हैं. लेकिन we are gone past that physical age of 25-30. So
Yoga is why yoga? Why not other exercises? Yoga, why you can do it. Whatever exercise you can do it in 90. You should start at 60. Can I do marathon cycling and at 90? No. Or 80? No. Can I do gymming? There is chances of injury in high intensity sports. There are chances of getting disbalance and getting any injury in any high intensity sports. But yoga is a thing where you involve your core body, where you involve all the muscles of the joints. You don't have only flexors. Like in gym, you only use flexors much than extensors.
Correct.
But there is no core muscle training or every muscle you need toning of the muscle because bone. There is a principle in orthopedics. Bone grow in the direction of stress. So whatever direction of stress you put a bone, bone will have strength in that direction. So in yoga, you involve every part in every direction. In some activity like squash, you will do only
Same
flexors,
movement,
only
yeah.
same movement,
Correct.
squash, badminton, anything. These are high intensity sport, require balance, require strength. So if you don't have that thing, with the age you will have, there is a incoordination between flexors and extensors. So chances of injury is more. So fracture, anybody having any fracture after 70s or 80s in hip or knee or any back, the chances of recovery is very less. Only one third of the guy achieves their pre-injury status. So yoga is a thing where you know core of your body, muscles from all the sides like flexors, extensors, and some external rotators also. Yoga involves stretching multiple directions. So every muscle is involved in this, and anybody can do it at any place, at any age. And they are different. Mild to moderate, anybody can do it. Not power yogas and everything that is relatively for the younger age group, but everybody can do it at 80, 60, 70. With osteoporosis, you can do these exercises.
Okay.
With osteoporosis, you cannot do any high intensity sports. You will have fractures, spine collapsing. You will see somebody saying कि सर मैं चल रहा था अचानक गिरा रिस्ट में फ्रैक्चर हो गया फीमेल्स इन 50s देन यू विल हैव सर थोड़ा सा वजन उठा लिया था कमर में डिस्क आ गई डिस्क के साथ साथ वो वर्टिब्रा भी कोलैप्स हो जाता है क्योंकि wherever you have soft bones like spine any joint near joint they we will have soft bones so they collapse fast so females में 50s में males may around 70s you will have this all fracture so you cannot go for high intensity sports so yoga is a thing which helps you in concentration building up your balance posture gait and toning of the muscle if you increase the strength of the muscle and bone quality is not good that bone is going to get fractured but it's like a putting up a pressure on a bone where the bone quantity is less it is not a qualitative. Osteoporosis is not that bone cells are bad. Bone cells are there, but the destruction is more compared to the construction. So the chances is you will have a fracture in any high intensity sports. So avoid that thing. Weather don't allow you. Then if you go outside, there is a rash driving is also there. So these are all we see all the cases on the daily basis that somebody goes for cycling, somebody just hitting from the back.
Oh, yes.
So you should be safe also. So yoga is a thing I have found it is suited for 30 also, 60 also, and 90 also.
I think one good thing, yeah, doctor has said is that only.
We recommend yoga from since the age of 8. No limit.
And
Even 110 age members are also performing yoga and remaining healthy. And as the doctor said, we can perform asana, and that's why Maharshi Patanjali or our Yoga Shastra says that there are 84 lakhs variations of asana, so that we should be able to reach in all sides, in angles, and till all the muscles and cartilages.
Most of the issues in 60s are that I'm not able to do sports, I'm not able to do some physical activity, I'm not able to do anything, sir, which requires some exercises form of thing. So that mental and depression issue is sorted out in yoga.
Oh, yes.
And you can do that exercising on daily basis at 60. So you get that happiness that I am doing some exercises or something, which keeps your mental health also in check. If you are not able to do any exercises for 6 months, you will see a sudden depression, thinking like कि अब मैं क्या करूं अब मुझसे तो कुछ काम नहीं हो रहा है मुझसे exercise नहीं हो रही है and then pain kicks once pain come you are not doing exercises that is a vicious circle which continues which keeps you in depression.
I think very good point doctor has said is whatever you cannot do for want of weather conditions, for equipment or whatever, like in case of COVID, we had seen we couldn't go out of home and many things, the sports activity, the outside came to a halt. And probably that is the time we realized that yoga is very important. One good part doctor you have said is the bone moves in the direction of stress. I think that is why he saying that yoga is good because we stress in all directions.
And this is much needed because all the bone have a blood supply from muscles also. So if you keep the muscles in check, tone is good, then you will have very less issues with the bone. Osteoporosis, as such, everybody is suffering from osteoporosis. Majority of the population suffering from osteoporosis because peak bone mass, then destruction is more. Then dietary habits we had started, like we are having more of preservatives, more of fast foods, and less of our natural foods, and whatever ancient things or whatever previously we used to have, like fresh things. We never used to preserve anything. Reserve is for where weather doesn't allow you to keep the food, fresh food. So they preserve food.
सही वहां पे
But we don't require any frozen thing. We don't require any preserved thing. We can get it on daily basis, so buy it on daily basis.
good.
And this is the first and most common thing, most common mistake we do. We go for preserved foods and everything.
So how do you on a daily basis, how do you keep measuring the bone density or something like that?
You don't keep measuring on daily basis. You do it in after 50. We should do it once for females. Males should do it after 60. More males generally have osteoporosis after 70. Once testosterone goes down. Female have osteoporosis kick in fast because they have menopause at 50s. So estrogen and testosterone are the main hormone which help in keeping the bone quality.
Okay.
So females have menopause, they don't have estrogen. So bone destruction is fast compared to the previous status. That's why female have been advised to have a hormonal therapy, estrogen receptor hormonal therapy. Estrogen help in keeping the bone quality good. It's the same thing with the male. Anybody having prostate cancer or something like that, we reduces his testosterone level so that cancer doesn't kick in. But that affects bone quality also. So you need to check that thing, and there is a DEXA scan, we say, which we do it with the bone quality we see, and there is a score, there is T score and Z score. But that is for our purpose. T score is we compare it with the normal guy. What is your bone quality, and we compare it with a 25-year-old young guy, his bone quality and your bone quality. So there is a ratio -1 to -2.5 is the stage of osteopenia, where you don't have symptoms but decrease bone mass slowly. You don't have any symptoms, very less symptoms. So people don't say कि यार मुझे कुछ इशू नहीं है, मुझे पेन भी नहीं है सर, मुझे मेरी बोन कमजोर क्या है, ये तो आपका रिपोर्ट गलत है. But once you have that symptom after -2.5, your level is -2.5, then you are ready for fracture. Bone doesn't improve in a day. It takes years.
पर ये कैल्शियम सप्लाई टैबलेट्स लेने से कैन दे एब्सॉर्ब इन द बोन?
हाँ, calcium supplements is needed whenever you are having at a high risk, like menopause. Any female crossing 40, you should start with supplements, because at 50, if you start, then 5 years, 2 to 3 years will be needed to have that backlog completed. A general saying, it is not a rough, it is a rough saying, like any pregnancy, if you have a pregnancy, then you need to have a calcium replacement for at least a year to two, with a D3 and with protein. But generally, we take it for 2 to 3 months till the time we go to gynecologist. After that, we just leave it. And we say कि तब तो कुछ नहीं हुआ इशू, अभी क्यों हो रहा है? Because वो backlog था, now you have to fill it up. And somebody is having fracture, then it is a very difficult thing. Bone is weak. If you fix it with plate and screw, metal have a good strength, but bone doesn't have any strength. You will see a lot of guys having osteoporotic fracture. They have re-injury, re-fracture. The plate doesn't hold that bone. So now we need to give him another supplements like parathormones. We have to give them some injectables like newer immunoglobulin are there, denosumab and everything. So then they say कि ये तो जबरदस्ती हमको injections और ये सब लगवा रहे हैं. But bone quality improve करने के लिए at least a year is the minimum thing required. So you cannot, I have a fracture sir, आज बस bone की आप strength बढ़ा दीजिए. It is not like that. It requires years of your muscle tuning, posture. Posture is also one of the thing which nowadays we see कि laptop में use कर रहे हैं. Head is like this.
Okay.
So
Hands and head.
osteoporotic fracture I had seen in an age of 19.
Oh, 19.
At 19 I had seen osteoporotic fracture of a girl with a spinal vertebra just fracturing with absolutely normal all parameters.
Oh.
Then we had a DEXA scan of her. So we had found out she's in osteopenia. But no other disease, nothing was there.
आर्थराइटिस पेन जो जॉइंट्स में आते हैं वो हैंडल कैसे करना चाहिए?
आर्थराइटिस पेन एज सच हर एक चीज का एक एज है. वी हैव योर एज, जैसे बोन का भी एज होता है, कार्टिलेज का भी एक रिपीटेड लोडिंग का एज होता है. बट इफ यू हैव गुड स्ट्रेंथ, जो पहला मिसकंसेप्शन लोगों का नी रिप्लेसमेंट और आर्थराइटिस को लेके है कि इफ यू चेंज योर नी देन यू कैन वॉक. इट इज नेवर लाइक दैट. इफ इट इज लाइक दैट देन अटल बिहारी जी चलते थे डे वन पे. वो नहीं चले, वो इसलिए नहीं चले कि मसल टोन नहीं था. पोस्चर के लिए आपको बैलेंस चाहिए. मसल यू फॉर वॉकिंग यू नीड अ बैलेंस. बैलेंस के लिए यू नीड अ स्ट्रेंथ. सो ये सारी चीजें आपको आइदर, वही ये सारी चीजें किकिंग होती है 60s में, where you cannot do these power things like going to gym, going to any other places. Bone is weak. The chances of fracture is much more. So you need muscle tone should be there.
Correct.
So you should recover fast. So arthritis के लिए ये है, muscle tone अगर ठीक रहे, so then you can walk. This knee replacement is last 30 years only, 50
Yeah.
years. You can say 50 years. Before that, people used to walk till the age of 90. We say कि यार वो कब इतना क्यों चलते थे. मेरे दादाजी, उनको कभी नी रिप्लेसमेंट नहीं लगा. वो तो दुबले थे, वो तो मोटे भी थे, उसमें मोटे लोग भी थे, पर उनको भी नहीं लगा. जस्ट बिकॉज दे, two three things are there which they used to do: good food, no preserved food,
Correct.
no fast food. Fourth thing, they never had this steps climbing.
Okay.
So steps is the worst thing happened to human being. It is space saving thing. So they used to climb mountains. Mountains is a slope. You can climb up on mountains.
Gradually, you are going up.
Gradually going up with your whole body is tilted like this.
Yes, yes.
In steps, you have to just put your leg up and knee. Over the knee, you fulcrum your body. So the stress on knee is quite a bit. People say
Is it going up the stairs or going down the stairs?
both ways.
Both ways.
Both ways it affect your ligaments, it affects your cartilage, and the pressure going on knee is much more than you can imagine.
Otherwise, okay.
So cartilage after 60s, the cartilage is very fragile. It is like a sponge. After repeated uses of sponge, you say you think it is just cutouts, or it have then worn out areas.
Correct.
So cartilage is having some collagen and some gel. Once you press it, the gel goes out. Once you remove the pressure, gel comes in. So after a repeated loading, that this architecture gets broken, and then you will have this wear and tear and pain and everything. So if you reduce just climbing stairs and downs, up and down, you will have very less pain.
We are actually getting the pearls of wisdom as far as prevention of osteoporosis is concerned from Dr. Anurag. He has got a very extensive experience in the armed forces also, and of course now when he is practicing. One question, doctor, everybody is, one of the participants has asked is, he has undergone hysterectomy, and after that there have been medications, and doctors have told us that your hair will fall, your nails will go, and osteoporosis is not behind. So what do you say about that?
Hysterectomy is when we remove uterus.
Yes.
And now in current time we keep ovaries there to keep the estrogen there, but the blood supply of ovaries somewhat from uterus also. So once you remove it, the blood supply to ovaries also is reduced. Some ovaries remain, some ovaries get degenerated, some ovaries get died, and it dried up and just died. So estrogen is less. Estrogen is required for keeping the bony health in check. So estrogen is less. Once you have estrogen less, then you have osteoporosis. And estrogen hormone replacement therapy is made for this such thing that your body should adjust after this hysterectomy. I have seen cases with hysterectomy done at 30, 35, and they have osteoporosis severe. If you don't replace it, if your body is not able to take the calcium, absorb the calcium, then you need that supplement to kick in. If you have that supplements proper in after hormone replacement therapy or with hormone replacement therapy, either estrogen will do or you take that medicine D3 and protein. Most common mistake is मैं calcium तो खा रही हूँ, but proteins नहीं है उसमें.
Actually, what doctor is saying, I think we all understand this, that having only the supplements may not work. Having only the frozen food definitely doesn't work. And I think what the yoga definition has been, given to us by our scientist Rishi Munis, Yukta Ahar Viharasya Yukta Karmasu Cheshtusar. Yukta Ahar, balanced diet, balanced kriya, Yukta Swapnavabodhas. How does the sleep helps us in osteoporosis?
Sleep is the biggest thing. Sleep is a blessing. Anybody getting good sleep is a blessing because all the repair work done in the sleep only.
Oh.
During day-to-day work, we have this destruction of bone. Daily, bone is the only tissue which is replaced over a period of time in a cycle. Some bone destruction is there, some bone formation is there. Some bone destruction is there, some bone formation is there. So majority of the repair, when you do repair, if you want to repair your house, when you will do it? When you just don't do any work and keep it like this, and somebody will repair it. If you uses it and somebody is working here, then you cannot do repair work. So it's the same thing happens with your body also. Sleep is needed for much of the repair work done to your bone, where some micro fractures are being healed. Rest is needed. Sleep. If you don't have a good sleep, we had done a study in NDA, National Defense Academy, where I had seen young 18-year-old cadet running and breaking his femur in a twisted manner while running only. So 18, 19 is not the age where you have femur fractures. So we had done a study. So in that study, only three things as we had changed. The sleep pattern we had seen, foods, and running on second the biggest thing is running on this cement roads. So we had just changed these three things. We had found it in 1 hour of 5 hours of sleep and 6 hours of sleep. We can reduce that stress factor to 30%.
Just by increasing sleep by 1 hour, doctor is saying that you can reduce chances of the fractures by 30%. I think that is one thing which is in our hand.
Stress factor. You should have your normal 6 to 8 hours of sleep and running on nowadays everywhere we find this cemented roads, cemented floors. So if you run on that, it is like running on a hard surface and hitting that hard surface with 80 kg or 90 kg of weight. So why these knee issues are coming up? Knee is the biggest joint in your body. If you run on a cement, if you hit on a cement with your body weight, it will absorb energy somewhere, either your shoe or knee. Shoe having a life, generally shoe have a life cycle of 500 kilometers. But nobody uses for 500 kilometers. Everybody uses for at least
Like
5,000 kilometers. So after some point of time, the cushion is not there in your shoe. Okay, it is gone. So then what will somebody will absorb the energy.
Correct.
So knee absorbs maximum energy, and then you have knee arthritis. You can have some exceptions. You cannot make it somebody is at 80 or 70 is running marathons and everything. But that are some, not for majority. People think कि अच्छा ये दौड़ रहा है ना मैं भी दौड़ूंगा. And then they have knee arthritis कि सर अब तो knee घिस गया है. Extensive अचानक से मैराथन करने लग जाते. You have to train your body at 20 to do this thing at 60. People don't remember this thing कि मैंने 20 में नहीं किया था. You have trained your neurons at 20, so you can read a book at 60 fast क्योंकि तब आपने neurons को train. Whatever you are trained in 20 to 30, you can use it in 60s. But if you are not trained, कुछ exceptions हैं, but you cannot make a majority statement with that. कोई अचानक से you see that अभी social media में आता है 110 kg reduce 40 kg, but after that at certain point of I had seen gym guys, I had seen intensive sports guys having knee issues, having back issues.
So you mean to say that even if you have got a body weight, there is no, it is not advisable to reduce it drastically.
Suddenly.
Okay.
You first you get the core body strength normal, muscle tone normal, and after that you start reducing. Target 1 kg a month max, not more than that.
1 kg a month.
Because the reduction of proteins are much. You will lose muscle mass. You will not lose fatty issue.
Oh.
In fact, what doctor is saying that sleep is required, the good diet, that is less of the.
And I think sleep time is also particular.
You
It
have
should be
to be.
particular.
You
कि
should be
मैंने
particular.
रात भर नहीं सोया तो दिन
नहीं
भर
नहीं
सो
it
लेती
is
हूँ.
नहीं, it is not compensated like that. You have to have your sleep properly. There is circadian rhythm. Why you sleep in night only? Why cannot sleep in day? The circadian rhythm which is developed over a million of period of time. So if you change it,
एक second, doctor, I just the circadian rhythm. What doctor is saying that the importance of darkness. Last week only we took the
Yes.
theme of darkness and how darkness helps us. I think what doctor is saying is so important, sir.
Circadian rhythm is a rhythm where your body, if I don't send any guy to a sunlight or like that, if we keep him inside a room for 10, 20, 30 days or month or so, he will go in depression, he will disoriented, his steroids and other hormone will kick in, and suddenly when you expose him outside, he will have all the issues of depression. Then this depression leads to dietary habits also. If you're not rooming and if you're not following that proper diet, wake up early morning, then this all thing and sleep in the night. Then you will have all the constipation issues with you. And this all thing affects ultimately bone. If you take out your bone from the body, it's just muscles. You're standing, you're walking, you're doing all the activity, but just because of bone is there. If you remove a bone, it is just a fat and muscles. You cannot do anything without that. So you need to check this circadian rhythm also. Ultimately, it affects your bony strength also.
I think what doctor has very important point he has mentioned is about the waking up early, which you all are doing. To join the sessions wherever you are, whether you are traveling, whether you are at some other place, all of you are getting up early to join the session and be there with the group. How does group helps in
Another important thing what doctor suggested is our asana are not working only on muscles or joints, they are working on bones. बोन्स का स्ट्रेंथ बढ़ाने के लिए भी उतना ही इफेक्टिव है आसन करना. हम सोचते हैं आसन मीन्स मस्कुलर है, ऑर्गन पे है, चेस्ट पे है एंड माइंड पे है, नहीं, लेकिन ये तो बोन्स पे भी उतना ही इफेक्टिवली काम कर रहा है.
जहां स्ट्रेच होगा वहां वहां बोन की स्ट्रेंथ बढ़ेगी. Wherever you will have stretch, you are putting stretch on bone, the bone will grow in that direction, bone will have strength in that direction. Ilisaro is a technique which we use in increasing bone or decreasing the bone. We can increase the length of bone and decrease the length. It is just based on the strength. 1 millimeter a day, we stretch the bone. We cut that bone, we put a rings, and we stretch 1 millimeter a day. And then bone grows in that direction 1 millimeter a day. Over a period of, you can achieve a 3 or 4 centimeter length. Okay. So you do it with Elizaro technique. So similar way, if you put stretch on your bone with yoga and everything, because other exercises it will focus on some particular group, increasing the strength, not in the multi-directional stress. You need a weightlifting also. You need some, but weightlifting will help you only in quadriceps, some amount of calf and flexors. What about extensor, core? We don't involve small muscles. Mostly we don't focus on small muscles which we focus in yoga. योग में ये होता है कि आप whatever mudras or whatever things you do, these are all small muscles are also utilized in that, and everything is included in it. From core, posture is a very common thing which yoga teaches us. Posture and balancing your muscle is much needed. आपकी फ्लेक्सर्स बहुत स्ट्रांग है और एक्सटेंसर वीक है, तो आप कुछ नहीं कर सकते.
जनरली आर्थराइटिस पेन थोड़ा थोड़ा शुरू हो गया तो हम कुछ भी एक्टिविटीज करना ही बंद कर देते हैं कि दर्द है. लेकिन जब वो एक्टिविटीज हम करेंगे तभी वो दर्द जाएगा. ये हमें अपने आप को एक लेसन देना है. एंड वी हैव सीन दोज हु हैव पेन, बैक पेन, नी पेन, उनका योग करने से वो दर्द चला गया.
It is nice to see some of you are while listening to this talk by expert Dr. Anurag. You are also doing your stretching. You are also doing your breathing. That's a good part. And we have actually one of our participants, Sudhir sir, who has got the knee replaced, but he has never missed a day of yoga.
And now he started sitting in even Vajrasan.
That is the much needed. He is recovered fast because he is doing all these toned muscle. Toned muscle will recover fast. Lot of these surgeries are done where muscle tone has gone. People say कि अब मेरा पैर अब चल नहीं रहा है. But you need a toned muscle, exercise muscle, because whenever you operate, your muscle strength goes by one down. So if your muscle are toned up, you can walk early.
By and large, doctor has given a very broad spectrum about osteoporosis, and we have covered all the questions which had come to us. Anybody want to ask anything in particular, even now? You can shoot. Everybody is unmuted, and you can ask that question in case you have to.
I am not told about any medical therapies or things required for osteoporosis. Reason behind because everybody have an orthopedic surgeon near him. They can guide them more on that. But you need why I'm just focusing on yoga and exercises more rather than medical key. You need calcium, D3, proteins, then other medicines also. There's parathormone and everything. This will be told by everybody. You go to any orthopedic surgeon, he will tell you you need these things.
Correct.
So I am focusing on this thing, ki lifestyle and yoga.
I think very important part by any doctor is lifestyle and how to improve it by you doing the routine. We have a question coming up. Can he give emphasis on knee pain and its management?
Knee pain is mostly, generally we have misunderstood that knee pain is because of cartilage going. Knee pain is because of your muscle tone going, muscle strength going. Cartilage is one of the issue, but after wear and tear of cartilage becomes smooth also. The cartilage is gone, and then only the bone is there, which is smooth, which is called sclerotic bone. After repeated rubbing, you will have that sclerotic bone. So people think that कि अब पेन हो रहा है knee replacement कर दूं तो पेन चला जाएगा, but it is not like that. It is because of your muscle strength, muscle toning, which has gone. You have this pain. Then second is the lifestyle. People say कि अब weight reduction है मैं steps climbing करती हूँ. Steps climbing will again increase your pain. Okay. Then walking barefoot on. Today we had copied Western culture that we are putting tiles in our day to day all the places, but we are not using any cushions. They use carpet or things like that because they have a winter climate. They don't have dust. So we had copied this thing, but we have not put a carpet over it. So you will have this knee pain because of this. I told you if you're walking on a bare feet on a cemented thing, then somebody will absorb the energy.
Correct.
Your energy, your momentum, weight is if your weight is 60 or 70 kg, it is going through your knees to the surface. If surface is not getting compressed, then knee will get compressed. And then your cartilage will affect it. And then you will have knee pain. Knee pain, if you keep your muscle tone okay, muscle strength is normal, then we had found out that arthritic pain goes also. Some remains there. You cannot reverse aging. Once something has gone, it is gone. But you can keep it in check by keeping your muscle and ligaments balanced. Because if bone is osteoporotic, then bone will bend like this. You will see knees bend like this or bend like that. It is because of osteoporosis and severe stress. If you keep your muscle tone okay, osteoporosis is still there, then chances of this having deformity is less.
So when you say muscle strength, it is knees here. So this side and this side.
This side, this side, this side, this side.
And the
all
calf
the
also.
calf, back of the thigh, front of the thigh, side of the most first muscle we lose is inside of the thigh.
How to get muscle tone?
The question being asked is the bone cancer hereditary? And the second question, how to get the muscle tone?
Bone cancer is a all different topic. It is hereditary. Some are hereditary, some are exposure related, like anybody having a radiation exposure. You will have higher chances, like we orthopedic surgeons, we operate, we have much of radiation exposure. Anybody having exposure of radiation or much amount of pesticides also, you will have this bone cancer. Bone cancer is something which is related to bone marrow also, which is related to blood cells also, and hereditary is a part of it, which every disease has some hereditary, some amount of hereditary thing will remain always. But you have to check that genes. Now the thing of cancer is like that, post-COVID vaccination, cancer, carcinoma and oncology is going to a whole another level. That viral thing we know, this is a cell which is causing the issue. So then they block that cell and their receptor. So molecular oncology is coming up way far than we can think. Oncology, after some certain period of time, you will have onco cases treated and living full life.
So I think one more question: what are the exercises to increase the muscle tone and also to improve the bone structure? I think
with
are
the
complementary questions.
it is with the age. I told you, whatever you can do it in 90, you should do it in 60, so that you continue it till 90. somebody के आज मैं साइकिलिंग के लिए जा रहा हूँ, and then you stop that exercises after a period of 6 months कि बारिश आ गई, आज तो मैं दूसरे शहर चला गया, साइकिल नहीं है, साइकिल खराब हो गई है, हवा नहीं है. These are all the reasons. So whatever activity which require very less external factors,
external
subjective
dependence.
factors, you should do the exercises like gymming. You can do it gym in your home also, but you have to maintain that balance. Somebody at certain age you lose that balance, and then you have injury recovery to original status is one third only.
Okay.
Only one third guy will come back to his normal status. Rest of them have some ailing issues, some pain. So muscle tone after 50s or after 60s, I advise yoga or any aerobic small. But now Zumba and everything, we have high intensity. At from Zumba injuring ankle like anything.
Okay.
You put a wrong foot and you will have injury. So in yoga you have that balance, systematic, and calm. If I am able to do this, then I can do this. If somebody is do, he can do
That
this.
also is.
That is also, it is helping him in doing that. But other activity like cycling, I have to go 20 kilometers per hour, 20, 20, 20. Zumba, everybody is doing it. I have to do it.
What are the reasons of calcium deposits? And I just missed that. So this you can ask this question.
You can
Calcium
confirm.
deposit in knees is not a deposit, it is a wear and tear. Like whenever two bones are rubbed, there is a certain amount of wear and tear of bone which form. Whenever we do a total knee replacement, we get this marble like bony deposits. We take out from bone.
We have a question coming from Sudhir sir.
So actually, calcium deposit in the shoulder. My niece has got calcium deposit.
Calcium deposit
And that
in
is
shoulder.
advised to do the operation for removal of the calcium deposit.
Okay. There are certain diseases like with diabetic, we found that this is a frozen shoulder of certain thing. Then calcium deposit is because of wear and tear also. But shoulder calcium deposit is very rare. If you found it in tendon, we have that fibrosis and deposition of calcium. Anybody having elbow injury, if you do massages or anything like that, you'll have calcium deposition. Body try to heal everything. So bone tendon junction is a place where you have that calcium deposits, which affects its stretchability. So you need to pressure up that tendon, take out that calcium deposit, and let it stretch and do the physiotherapy. But this is all expert guided and it is person dependent individual cases. Shoulder calcium deposit is rare and it is post injury most of the time, or certain time it is due to some other ailing issues which we have to see it in pre injury status also.
Yes, we are of course running out of time, but Shrikant sir, in case you want to, you had asked some question. Shrikant sir is one cannot
No,
go
I
back
just
at young age. So how to proceed henceforth after 40 to 50?
You don't have enough of your bank balance of your bone. Now you have to keep checking that your destruction is less. So avoid any high intensity, because any high intensity sport you don't feel कि अभी fracture हो गया है, but there is a micro fracture going on day to day basis. So if you load more on your bone with high intensity, load it with a slow that let it gain its strength also without much loss of bone. So high intensity workout you should avoid. Go for swimming, go for yoga, go for all these activities where muscle or any high intensity workout like hitting ground, like tennis, badminton, football, hockey. These are all high intensity sport. So you should avoid this thing. Go for this yoga and swimming. Like
You wanted to ask some questions, sir. Shrikant sir. I think you
yeah,
are
I
in
just
different time
I
frame.
think I think he has answered it. I was just asking about the exercises for toning of the muscles, because that's important to make sure that there is enough strength in the knees?
Muscle toning is the first and foremost thing. If knee replacement is the answer for pain, then after knee replacement you should not have any pain. Nothing should be there. Why you require to go physiotherapy for a year or 6 months? So do that physiotherapy before the surgery rather than after the surgery.
Okay.
Almost 30-40% guys will have no pain after that. If you do the surgery, this is not something which is doing since ages. Which we started knee replacement is last
Every
30 years.
small activity counts. So that's what I think the genesis of all that stuff.
Everything is helping in it.
I think that we can go on talking and asking about these questions, but the complete sum of all that discussion is do something which is good for us. Take a healthy diet, take good sleep. I think Dr. Datta has clarified it in enough, with a lot of emphasis on the repair work, what the body does, and the micro activities, what you can do without any weather condition, without any equipment. So, हम योग वाले हैं तो हमको योग करना ही है.
ये भी अभी माइंड से निकालना है कि अर्थराइटिस है तो मैंने सब एक्टिविटीज रोकना है. वो दर्द बढ़ता ही जाएगा, उसकी जगह जो भी बन सकता है करना जरूर है. एंड दैट फैसिलिटी इज अवेलेबल ओनली इन योग.
Some amount of exercise is needed, some amount of toning is needed. Confidence after pain, you lose confidence. Why you fall? Because of disbalance, and then you lose confidence for life, for walking on your feet. Right? Why you operate? Bone is not getting healed early by operation. It is being just maintained in that some specific like we operate because we have to keep that bone in certain direction. Second, it is not heal early. If you operate, you plate, that bone will heal in 6 weeks, whether you operate, whether you don't operate. But operating thing which we keep the bone in a certain direction or scale. So you require to recover early from that injury. We operate. We ask you to go out of bed early. But osteoporosis की वजह से हम we stop telling them कि अभी 6 महीने तक उठना नहीं, 3 महीने तक उठना नहीं because of osteoporosis. अगर osteoporosis नहीं होता तो next day patient will walk. कि भी ठीक है तेरा bone osteoporotic नहीं है, you walk on that. But we have fear कि bone will cut out with that implant. So osteoporosis को check रखना इसलिए जरूरी कि जिस दिन आपको जरूरत होगी उस दिन वो नहीं होगा आपके साथ bone, and then
calcium and protein,
bedriddenness and everything will be there.
Yeah, I think that is just the time, and let us give thanks to doctor by clapping, and that's the best thing we can do. We are so much thankful to you, sir, having taken out your time. He's got a very busy schedule. Generally, he operates in the early mornings, but today, with our request, he had postponed all his activities after 8
Still,
o'clock.
after our session, he is rushing for operation.
Operations.
So we must give big thank to the heart. Thank you so very much, doctor, and very expert advice, and very happy to listen your advice. And I'm sure everyone will follow diet care, sleep, and as we are doing every day, you.
Before we conclude today's session, the obvious question in your mind is, हमने डॉक्टर साहब को ढूंढ के कहाँ से निकाला? The answer is, you remember that I had a knee injury, the ligament and the meniscus tear and etc. etc. Many doctors told me you go for knee replacement, go for the MRI, this that. And Dr. Anurag was one. He said MRI की कोई जरूरत नहीं सर आपको बाकी कुछ की जरूरत नहीं है. Your muscle tone is okay, so you will be able to do it, but you have to do it on a regular basis. And I think that is the day, doctor. About 3-4 months back, I have been patient with it. I have an issue, but then I am able to take care of it. And thanks to you for all that. So that is how your question must have been answered कि हमने डॉक्टर साहब को कहाँ से ढूंढ के निकाला. Because in our session we do only that what we have experienced and found it good.
और भी क्वेरीज है तो आप डायरेक्टली सर से भी कांटेक्ट कर सकते हैं. ही विल गाइड यू, और यू कैन आस्क क्वेश्चंस इन आवर ग्रुप और मे बी पर्सनली. तो हेल्थ अच्छा रखना ये पर्पस है.
And any cure, as far as doctor is concerned, it happens when you have faith in a doctor. And I have that full faith. So whatever place you are in, with the technology. He is always available to you, and thank you so very much. We'll conclude today's session by doing Omkar because we already run out of time. So let's sit together, back straight. Your knees are touching the ground as far as possible. Join the hands in Namaskar Mudra. We are doing Akar, Ukar, and Makar. U and Ma, 1:2, 2:4 proportion. Breathe in full 3 times and do the Makar. Ah. Ah. Ah.
The big palms, spreading those vibrations equally throughout the body, making cups of the palms, keeping our thighs will relaxed and peaceful. Deep breath, and let's go down with reverence, gratitude.
Hari Om. Have a nice day. See you tomorrow, same time, same place. And thank you so very much, Doctor, one more time. Thank you all. And write your, of course, Swadhyay. His doctor's number is there on the group. We'll again put it so you can consult him whatever for whatever issue you have.